Some people go vegan, some are vegetarian, and then there are pescatarians. So many labels. I understand the confusion, but the point is, what's the difference? Professional bodybuilder Tori Washington sat down with Dr. Derek Papp, and here's what he had to say.
There are different labels that people have for diets. Some people say they're vegan, some people say they're vegetarian or pescatarian. My sister and brother-in-law are pescatarian. What's the difference between these, and do you like using labels?
Wow, that's a fully loaded question that if I had more time to answer. So when it comes to labels, I don't like labels. You know, I think sometimes they box you into a specific way where it doesn't give you leeway or flexibility to do things that may not be part of that label, but are part of your character. Okay. You know, because I don't like to be restricted. Sure. And I feel like they do restrict people. And so oftentimes the vegan label can be restrictive in that, oh, you gotta be this way and that. If you're not raw, then you're not truly vegan. You're not fully homeopathic or what have you. And I don't like those type of labels. So another thing I don't typically use when I speak is diet. Okay. Diet to me is...
That was gonna be my second loaded question.
Because I feel that two things about diet. The one thing is you get on a diet, you can get off a diet. The second part is I'm not ready to die yet. I'm here to live. That's what we're here. We're here to live and thrive.
I like that.
That's how I look at it.
So going plant-based can provide you with more than just health benefits. It also kind of helps the environment and the community, right? Yes. Can you explain to us why this is?
So if you look at it, you know, there's a lot of information out there that talks about how living a plant-based lifestyle helps the planet with consumption of water, you know, less gases are released to the environment when it comes to animal agriculture. Right. Animal agriculture is one of the biggest proponents of causing all this mass destruction that we have.
Would you say that there are a lot of misconceptions about living a plant-based lifestyle?
Oh, yes.
Could you tell us some of those?
You know, when I first started, one of the main ones was, where do you get your protein? Right. And I always wanted to respond in more of a sarcastic way, like, do I look like I'm missing protein? Yeah. You know, but I had to hold back and say, you know, well, protein is in everything. 99.9% of fruits and vegetables contain protein. And what the misconception is that you need so much protein in order to be an average individual. And that's not the case, you know. So to realize even a full-size watermelon contains about 28 to 30 grams of protein.
See, I didn't know that.
Yeah, most people don't know that because they think fruit doesn't contain any bit of protein. And the protein in fruit and vegetables may not be as huge, such a massive amount as a piece of steak or something, but it does have it, and you don't have to consume as much.
You have a graphic looking at a couple different foods that are sources of protein that are plant-based. Do you mind taking us through these?
So, you know, lentils, edamame, tempeh, black beans, and almonds, all of them. I love them all.
Patients who have any kind of shoulder problem really have a hard time sleeping. So I'm not sure exactly why that is. It's probably because
sleep position, maybe.
I think what happens is as your body relaxes, it actually takes that ball and kind of rests it in a place that may not be comfortable and may be painful. It may be pinching off that tear, and that may be why you had that increased symptoms. A full thickness rotator cuff tear often will present with weakness. So they'll have problems getting their shoulder above their head. And that's just part of the thing, because they don't have, what happens is the ball isn't able to be centered in the glenoid, and so what happens is because of this dysfunction, you can't raise your arm. A lot of times people can hide that if they're strong in their deltoid, but you can isolate the muscles on the inside by turning the arm like this. And so if I do that in clinic and I push on you, a lot of times people, they'll look strong like this, but if you turn them like this, they can't hold it up because that muscle is being isolated.
Does that affect a golfer's ability to reach his sort of maximum potential?
I think what happens is a couple different things. One, it's really painful. Okay. The other thing that happens is, so you have to get over the pain. Sometimes when the material inside the disc comes out, it'll actually compress the nerves. So you can get kind of it's neuropathic pain. So the pain will shoot down your leg or into your arm or your hand, depending on where the disc is. And that can be, I mean, besides being really annoying, it can really keep you from playing. And then the other thing too is if it's really compressing the nerves, you'll get weakness, and that's a much bigger deal. always want to have enough fuel in your body for whatever it is that you're doing. You know, there are people who are exercising to lose weight, and so they're going to have a little bit different goal than somebody who's training for a marathon.
So let's talk about that person who may be training for a 5K, a 10K. I mean, whatever it is you'd love to do, a full marathon with 26.2, right? Yeah,
Right.
that's a lot of miles. Or a triathlon, for that matter. We hear a lot of people that say the night before you got to really load up on those carbs. Is that true?
I mean, one of the things I like to say is when you're training for a marathon or you're training for a triathlon, you're also training your diet. You're training yourself and your body and your eating habits. So yes, there's a lot of benefit if you choose to race, to load up on carbs the night before the race, because what you're trying to do is build up your glycogen stores in your body.
And that will do what? For example, like you have a lot of pasta or maybe some rice or some bread. I'm just thinking of the carbs off my head. Whole wheat, of course, very important.
Right.
What does that do for the body besides giving that energy?
Well, that's what it's doing. So it's basically your body's taking all of that energy, because that's functionally what it is, and it's storing it inside your muscles. So when you wake up the next morning and you go on your race, ideally your body's full of fuel. You want to know the areas that you need to necessarily be more careful, where maybe there's more traffic, or maybe there's not a bike lane and maybe you have to go up on the sidewalk, because I think those are areas where you're probably at more risk of hurting yourself.
Let's just kind of talk about injuries. Obviously, you see a lot of them in your practice in sports medicine. So tell us about some of the injuries you're seeing in cyclists.
Okay, well, one of the probably the thing you see most of is trauma. So people who fall off their bikes. The most common injury is actually clavicle fractures. People can get other muscular injuries when they fall at the same time. Usually when you fall off of a bike, you don't have time to react. So again, clavicle is probably the thing that gets hurt the worst first. If you have time to push out, it's easy to hurt your wrist or your hand. I think one of the other things that cyclists need to take care of is their back and their spine. You know, if your seat height isn't the right level, it's really easy either to hyperextend your neck, and that can cause pain over time, or at the same time it can hurt your lower back if you're not in a position that's comfortable. When we talk about a Parsed effect, it's basically this part that's going kind of up here.
Okay.
And a Parsed effect is a stress fracture. It's a stress reaction in the back. It doesn't always lead to an actual fracture, but a lot of times you'll have inflammation inside the bone, and then if you don't treat that with rest, usually, that gets worse and it progresses on to a fracture. Depending on how bad it is, you can treat it a lot of different ways. We do try to treat it without surgery most of the time. Sometimes that includes wearing a back brace. Sometimes it doesn't. Again, it depends on when you catch the patient and how they're doing in terms of their treatment. And then every now and then you wind up getting surgery where you actually will put in a screw to fix the fracture.